Well, welcome to episode 2 of Triangle Dentistry Talk. I'm your host, Dr. Carl Bernstein, and I'm here with Dr. Nate Leedy from Genesis Dental. How are you doing today?
I'm doing great. How are you doing?
I'm doing well. And today what we're going to do is we're just going to kind of, introduce Dr. Leedy, get the Cary and Triangle area to know this amazing dentist and person. So what we're going to start with is just to get a little bit of knowledge about him. Where are you from originally?
I'm from Harrisburg, Pennsylvania. That's where I grew up, which is the capital of Pennsylvania, and in the center, the southeastern part of the state.
Now, are you a sports fan at all? I don't know if that's close to Philadelphia, if that's an Eagles fan, or if that's Pittsburgh. I'm not sure. Are you a sports fan at all?
Yeah, I grew up a Philadelphia sports fan, so I used to follow the Phillies, the Eagles pretty religiously, and then also Flyers and the Sixers to some degree. Since I moved here, I haven't been on the sports scene, the Philadelphia sports scene, as much. But when they make the playoffs, I do turn the TV on.
Well, that's
So
good to
I'm
hear.
kind of a feathered fan having moved here, but
Yeah.
still at heart.
Well, that's good to hear. I'm from Cincinnati and I'm a Bengals fan, so we don't really like Pittsburgh fans. So good thing you're an Eagles fan and we can continue
That's
this
right.
video. But as we, to get a little bit to know a little bit more about Dr. Leedy, what motivated you to become a dentist?
So what motivated me to become a dentist was really I grew up around it. My parents are both in the dental industry. Dad's a dentist and my mother's a hygienist, and they're actually still practicing in Harrisburg, Pennsylvania. So I grew up around it, and I felt like it was something I'd be comfortable doing as a career.
And where did you train? Where did you go to dental school?
So I went to dental school in Philadelphia at Temple University School of Dentistry, and so I graduated from dental school and actually went right into the military. Was active duty in the Navy Dental Corps for 5 years. One of those years was a residency. So out of dental school into a military residency for a year, and then overseas to Japan, where I spent all 4 years of the rest of my career there in the military, which was a total of 5 years, 4 of which were in Japan.
That's awesome. Well, we all thank you for your service. We greatly appreciate that as well. So, as we're getting to know Dr. Leedy, we can already see that he's a wonderful person. And as we already we'll get to find out how that comes down into his office and why his office is awesome. And it's a place that everyone should at least experience or at least give it a chance. But we'll get there and explain more about that in the coming minutes here. You said you're from Pennsylvania. What made you come to Cary?
So I spent, of course, 4 years overseas. And then when I got out of the military, I decided I wanted to come back to the East Coast and be close to family. I wasn't certain that I wanted to come back to Harrisburg specifically because my parents actually spend a lot of time in North Carolina on the coast. And we've always, as a family, spent time on the coast. So this is a place where I felt like I could move. And then as they tended to get older, they were probably going to come down here anyway full time, which probably will happen at some point. They're still working and still comfortable. So I felt like it was the right place for me to be. And it turned out to be the right decision. So my parents come down quite often and get to see my kids, and we get to hang out on the coast. So
Well, that's great to hear. Yeah, North Carolina has all 4 seasons. It's a wonderful state. It has everything, obviously the mountains a little bit out west, and we got the beach out east. And so it's perfect state. You can get everything, and everyone wants to move to North Carolina right now. So you picked a great area. Cary's a wonderful area as well. So, tell us a little bit about your dental team. And as if you guys don't know, the people who are listening, the doctor and Dr. Leedy, that is at Genesis Dental, a lot of the office takes, what his shape and it molds from him. But the dental team is very important in dentistry. And you may spend more time with the dentist team than more the dentist itself. So tell us a little bit about your dental team. Tell us, why they're so amazing.
yeah, so I'm very blessed to have a great dental team. I think they're very engaged with patient care and the patients as people. My dental team is everybody's pretty much cross-trained in my office. So our front desk, our wonderful front desk administrator can go back and do x-rays and assist, and our treatment coordinator can assist. Our hygienist actually has assisting experience as well. So because everybody can fulfill more than just their job description role, I think it makes it a dynamic office environment because everybody understands all the moving parts. So that's one thing I think is very special about them. And then as people, they're great people. I feel like I'm coming to work and kind of being around people I enjoy talking to and working with. And I think that so they're more than just staff. They're team, they're family members in a sense. Team family members is what they are. So it makes for a really good office environment. And I think our patients pick up on that. They like to come in and chit chat, and we like to talk too. So it's a place not to just to get your dental care done, but to kind of hang out and enjoy conversation in life.
And that's great. And I was just over at Dr. Leedy's office, and if you haven't been there recently, it's gorgeous. He just did some renovations there, and it's honestly probably one of the prettiest offices I've been to. So, it definitely makes you want to sit there, hang out, talk. And if their staff is that incredible, which I know it is, I've met them, you want us to talk there and you want to spend time and get to know everyone and understand, what the experience you're getting is not just the dental work. It's also the experience that you get with talking with the staff and the doctor and Dr. Leedy himself. One thing that, you kind of talked about with your staff, and is there any, we obviously see mostly English speaking patients here, but is there any other languages in your office that you specifically have fluent speakers in?
Yeah, so I think that's another thing that makes our office special too. We're actually trilingual. So on top of English, we have the ability to communicate in Spanish. And this is not me. I wish I could say it was from me. But we have Carol who's great speaking Spanish. She grew up in a Spanish-speaking country and therefore can engage in conversation and translate. And then my wife, Mai's the practice manager, is from Japan and fluent in Japanese. And as a result, we have a nice population of Japanese patients who are expats in this area. So English, Spanish, and Japanese.
And that's awesome, and it's the more patients that you guys can take on and make them feel comfortable, the better it's going to be for everyone. So definitely to the patients listening and to the people listening, give Genesis Dental and Dr. Leedy a chance. And I promise you won't regret it. So as we move along, your dental office is unique. It's a little bit smaller, a little more personal. Dr. Leedy spends a lot of time with each patient. You can already tell right here, he's got a wonderful personality, really likes to engage and understand the patients themselves, not just their dental work. And he gets to know them really well. But, would you agree that kind of makes your office a little bit unique in this area?
I think so. I think that everybody is, of course, engaging with patients, but so I don't think we're anything super special, but I think that I really enjoy getting to know my patients as people. I think that's what makes my job fun, is because I'm interested in other people, and then my team feels the same way. Yeah, to answer your question, I think that's what makes us unique.
And I know when we spoke a long time ago, and I've known Dr. Leedy for a year or so now, what makes one thing that patients are always concerned about is there's always dental anxiety, a little bit of fear going to the dentist. And that's, old stories from our parents and grandparents, and dentistry has changed a lot since then. But how do you deal with apprehensive patients and getting dental treatment, and how do you kind of calm their fear or concern?
So, we have a lot of patients who have high dental anxiety, and I think where we've been successful in making them comfortable are a couple of things. I think number one is our technology. We have some nice technology that makes dentistry just more efficient, so less visits and maybe less intrusive with the digital scanning and the CBCT. In the clinical side of things, too, we'll do oral conscious sedation, which is basically a pill that the patients can take that relaxes them and maybe make you take a little nap while you get your work done. So those those things really help make it a very comfortable experience for patients. Because we have a lot of patients who are high anxiety, we're just very aware of that. And I think that we have become an office that's very gentle. We're all very gentle as a result. It's kind of forced us to really focus on being gentle. And so I think we have a lot of happy patients who come in and realize that there really isn't much to fear in dentistry anymore with the technology and the techniques that are out these days.
Yeah, and that's great, and one thing that I kind of want to point out again that Dr. Leedy said is there is, a little bit of some conscious sedation that they do and some form of sedation that makes you feel a little bit more comfortable if that's with a pill or liquid or whatever that could be, so that's something if you are nervous, or you're a little bit dental anxiety, Dr. Leedy and Genesis Dental is a great place to give a try. And I think you'll feel really comfortable. And I'm telling you, the staff, and when you walk in, you feel relaxed when you walk in. I don't know if it's just how the office looks or if it's just the atmosphere that they all have in that office. It makes you feel relaxed. And that's obviously, what, just looking at Dr. Leedy, you can tell he's a relaxed person, very confident as well, which is wonderful and who you want as your dentist. And so I think all of that comes out in his office as well. So, so far, hopefully what you're hearing is kind of something you want to experience and give a chance. So let's kind of take a little sidestep and get into a little bit about dentistry itself, kind of touching the basics on what patients may ask and what they want to know. And so the basics, what are the regular dental visits? How many checkups a year? Is it 1, 2, 3, 4? Is it just for cleanings? A lot of people don't understand or don't know. And so how many checkups do you want to go for a year?
So most people want to do a checkup and cleaning every 6 months. That's the normal routine for, I'd say, dentistry in general, and especially in our office. Now, there are patients who have who might be susceptible to getting cavities fast, or might be susceptible to gum disease, or already have gum disease. In those cases where they're more susceptible to oral conditions, then I would recommend the patients come in for those cleanings every 3 to 4 months.
Well, that's perfect. And that's the one thing that, most people understand is you definitely want to go kind of every 6 months, and not every time they're taking an x-ray, and not every time, you're going to have a cavity. That's the goal. The hope is we can prevent cavities. That's what we all want. If we could have you have no cavities, I think we'd all be happy. Even though we maybe have to find a new career, we'd be happy that we did our job, but I think there are times, as Dr. Leedy said, we're going to recommend to go more than twice a year, because there may be some issues that you have. You may be missing some areas in brushing or cleaning that we can help prevent future dental work that will save you pain in the future or save you treatments in the future, which is what everyone wants to do, is save in the future there. Does that sound about right?
Sounds right.
A lot of questions that people have, especially, Dr. Leedy is a general dentist and can do many things, but we always hear about, aesthetic dentistry, and we have implants and crowns and veneers and, all type of other fillings. How are those incorporated into your office? How do you talk about patients with that? And what type of treatment do you like to do? Do you have a passion for?
So what I like about what we do here is we do a variety of different things. And I like the variety of things because it keeps everything interesting. And I like to learn a lot. I've always been a learner, a hands-on learner. So here in the office, we do an assortment of things, from routine dentistry, which would be your fillings and crowns, and up into root canals, which we do. We also are adept at taking teeth out and grafting the site and placing implants for teeth that we can't restore. So with that being said, on my side of things, it's everything from fillings to implants, oral surgery and implants. On the hygiene side of things, I think we're a little bit unique too, in that we do the airflow cleaning, which is like a erythritol powder mixed with a warm liquid, warm water rather, that is kind of like a pressurized car wash for your teeth, for a lack of better term. But it's a very gentle way of getting a dental cleaning. It's a very unique way. And we offer that on the hygiene side, which our patients like. So, yeah, we offer a lot of different things. I'd also mention, too, we do even cosmetic dentistry with veneers and cosmetic crowns. And then a little bit of clear aligner therapy. Of course, we send our more extensive cases to you, our favorite orthodontist. But where we might need to move a tooth just a little bit to get into place, to place a veneer correctly or something like that, just to gain a little bit more ideal alignment, we also do that to some degree. So yeah, an assortment is what we offer. We're a comprehensive dental office.
Perfect. Yeah, and that's how I know Dr. Leedy really well, is we do have some shared patients. And sometimes orthodontics, how it plays a role in general dentistry is, especially in some complex cases, we may need to move teeth around before you're able to get an implant or a bridge or a crown, because we want it to be in the correct spot and only do it one time. We want you to be happy in that. So definitely, orthodontics and obviously here at Bernstein Orthodontics, where I'm at, definitely is a big asset to Dr. Leedy's and Genesis Dental. But he also is capable of moving teeth as well. And so it's not that you have to always go to an orthodontist, but definitely when it starts to get a little more complex, and Dr. Leedy said, he has people that he can use to help him achieve the goal that he wants with your smile as well. When it comes to patients trying to figure out how do they maintain good oral hygiene, is there a certain toothbrush or a brand of toothbrush that you may recommend, such as electric, Sonicare Oral-B, a manual toothbrush? Are there better toothbrushes that people can use? Or do you think that there's not much of a difference there? What do you think there?
Well, I find that brushing your teeth is very technique sensitive. So you kind of have to know what you're doing. And I don't think you should ever be embarrassed to ask your hygienist how to hold the toothbrush. It seems very basic, but it really does make a difference how you angle the bristles, right? So if you know what you're doing with a manual toothbrush, you can be very good at maintaining your teeth. But what we find are the electric toothbrushes are very popular with our patients, and they're very effective. And they allow for a little bit more leeway if you don't get your angulation correct, right? They also have a lot of bells and whistles. So they'll show you how long you've been in the mouth. And some of them even show you where in the mouth you were brushing, which is pretty amazing. So I would say first thing is like knowing how to use your toothbrush. And if you're a little bit on the high-tech side, you might want to get an electric toothbrush because they're a little bit more fun. The second thing that I think is important is that you clean well in between your teeth. And whether you do that with traditional floss or a water pick, I think is up to the patient. I'm finding more and more patients, even younger patients now, are starting to get water picks. Mm-hmm. And the literature is also showing that water picks are quite effective for cleaning in between the teeth, as effective as flossing. So if you really have to up your game in getting the right tools at home to keep your teeth clean, my recommendation would be an electric toothbrush and a water pick. I think they're very effective at keeping everything clean at home and maintaining a good oral health.
Well, that's perfect. And this kind of runs into a question that we always hear from people, maybe more so when you're out with friends or family or making jokes with each other. But how do you address some people, always may notice they have dry mouth or bad breath, and sometimes it may not be just their brushing that's an issue, and their brushing could be good and it could be a dental related issue. But, how would you tell people to address, if they think they have bad breath or dry mouth?
Yeah. So first of all, a lot of the times bad breath is tied into having a dry mouth, lack of salivation. A lot of pharmaceutical drugs that are prescribed to people will cause dry mouth. So we want to figure out what is causing it. Normally, I wouldn't say normally, but a lot of the times it is because the mouth is just dry, in which case what we try to do is get the patient to salivate again. And I like the use of xylitol type mints, especially in the older patients. It's easy for them to use throughout the day. Xylitol is not going to cause decay. It's actually sort of going to create an environment where decay can't prosper. So we want to make sure that we identify the cause. If it comes down to not being dry mouth that's causing it, we want to look at the patient's diet and then also look at whether or not they're cleaning their teeth properly, because sometimes it's just a matter getting in the right spots, like we were talking about before, with the right tools to cut down on the bad breath. So, and then lastly, what I would say is that we also want to check for systemic conditions that might cause it. Lack of good bacteria in the mouth can cause a fungal reaction to occur. And if that happens, we can usually identify it clinically and then prescribe something to get the mouth bacteria back into balance.
And that, what you kind of said there, there's systemic health or overall health if you don't know exactly what the word systemic is. But, a lot of people don't understand that there is a connection between oral health and your overall health and your general health. And you definitely need to maintain a good oral health if you want to have a good, full, balanced health as well. So, are you able to explain a little bit of that connection there, with kind of maintaining good oral health and how that contributes to having good overall health as well?
Sure. Yes, I think the connection is very valid, and I believe that, I tend to see studies come out or news come out every 6 or 9 months that link some bacteria in the mouth to some condition in the body. So we know that if you have an abundance of a bad bacteria in the mouth, it's probably going to be in the bloodstream. It's unavoidable. So we want to cut down on that bacteria load. And what I would say is we actually have saliva testing here. So if we suspect that's happening in a patient, we can actually take a little, it's a little basically small piece of paper, basically, that picks up on the saliva. It's like a small paper towel. We can send that to the lab and they can test the saliva and see what the bacteria counts are and how they might be linked to certain systemic conditions in the patient. So we use that from time to time, and that does prove that that's valid, that there's an oral systemic health connection there.
That's perfect. And that's good to know, and definitely people should understand that our oral health does contribute to everything else in our body. And it seems so easy to take care of, but sometimes we're missing areas and we just don't know. And that's why we recommend those regular checkups with the dentist and to see it. And we want you to feel comfortable with going to the dentist, not afraid and skipping appointments because you're nervous they're going to tell you something's bad. And, after getting to talk to Dr. Leedy just a little bit, I mean, he's never going to shame anyone. We all have issues. We all struggle sometimes with brushing from here and there, and we may miss a spot, even the best of us. And so he's going to give you the right information. He's going to make you feel comfortable. He's going to make you feel happy at the end of the treatment that you came in and was able to obtain knowledge. And definitely going to the dentist, it shouldn't just be us telling you kind of what to do. You should hopefully be able to learn. And Dr. Leedy, as you can tell here, he's going to be able to teach you so much. I learned some information already that I didn't know. And I went to dental school as well. So you're going to, not everyone's going to understand everything. And so this is a great time. And if you're listening to this, to gain some knowledge on that. All right. So, one final question that we had for you was, every person in dental eventually gets some emergencies, such as a toothache or a chipped tooth, cracked tooth. How do you guys deal with that?
So if we have a patient who has an emergency during working hours, we try to get them in as soon as possible. So if they call the office, we will sort of talk about what they're experiencing, and given the urgency of the situation, we'll carve out some time in the schedule so we can at least see them and see what's going on and make a diagnosis. And if it's treatment that needs to be done that day, so in some cases there's an abscess tooth that needs treated, or there might be a broken down tooth that needs to be taken out, we will find time in the day to do that. So I feel like we're pretty good at fielding dental emergencies. And I would say for patients who are having a dental emergency during the nighttime or on the weekend after business hours, if they call our office, we have a phone number. We have instructions for a number that they can dial that'll go right to my emergency line. And we're usually good about getting their voice messages within half an hour or so. So even on the off days, we're prepared to field emergencies.
That's great. And if it's a patient of record, obviously they'll know how to call you, but is even a new patient able to give you a call or contact the emergency number after hours?
So yes, new patients can give us a call. We take preference over new patients, if they're a patient of record, I'm able to prescribe something. So I usually upfront about I'm not able to prescribe something over the phone if I don't know you. So we really try to get in and meet, even if that's in the after hours, to at least see what's going on before we can make a call in a prescription if it's needed or treatment. So for patients of record, it's not a problem whatsoever. I want to say we're very accommodating to new patients, and we do see that new patients with dental emergencies, but we're careful so that we're able to see them face to face to know that they exist and there's really a problem going on first before we do anything. But yes, we're always open to having new patients join our practice, even if it's through a dental emergency. We enjoy that. We enjoy helping people and having them join our dental family, whatever way they can.
That's awesome. And I, we want to thank you, Dr. Leedy, and Genesis Dental for taking your time to spend with us to talk about your office and to give this information to people in the Triangle and Cary area. Is there any final words or words of wisdom or dental wisdom you'd like to say to anyone?
Well, I just first of all would like to thank you for having this interview, and I would just say anybody who needs a dental home, please give us a call. We accept patients of all ages, and we're always happy to have new members join our dental family. So that's that.
Dr. Carl Bernstein, this was Triangle Dentistry Talk, and have a good day.